Welcome to today's show, everyone. I'm Dr. John Bartemus, your host, and today I'm excited to interview Dr. Achina Stein. Dr. Stein is a 25-year board certified psychiatrist in the state of Rhode Island, and just last week her book called What If It's Not Depression debuted, and I'm excited to interview her about her approach to depression and things that are thought to be depression with her patients. Dr. Stein has experience in psychopharmacology and cognitive behavioral therapy, working with populations ranging from prison inmates to inpatient geriatric patients. Dr. Stein is a distinguished fellow with the American Psychiatric Association, and in 2008 was named the Exemplary Psychiatrist Award winner for the state of Rhode Island. Today's show is brought to you by Functional Health Enterprises, where it's our goal to empower your health through knowledge. So, Dr. Stein, welcome to the show.
Thank you. Thank you for having me, John.
You're welcome. And so I think the first thing that would be interesting to our readers is what was behind you taking time out of your busy practice working with patients and sitting down to write a book?
There's actually multiple reasons, but it really came to a head when I had a patient come in one day who said, why is it that my own doctor doesn't tell me what you're telling me? And, there's a group of people who are going from one doctor to the next, or other providers, not necessarily MDs or DOs, but they are, basically given an exam, asked a lot of questions, had some blood work drawn, they're normal, and then they're told, well, you've been to several providers, maybe what's really going on is that you're depressed. And then they're handed a prescription for an antidepressant, and they don't think in their heart of hearts that they're depressed, but they don't know what's wrong, and they're just trying to find answers and solutions. And so by the time they see me, they're extremely frustrated and despondent. I'm more obviously depressed because of the situation that they're in as a secondary depression. But, then once they give me their history and we sit down, we talk about it, and the time that I give them, I'm able to come up with a plan to be able to reverse those symptoms. And they also understand why they would or would not need an antidepressant. So a lot of questions get answered. And so I felt that, I just need to put this pen to paper and hopefully head off a lot of people at the pass, so they don't go down that road with so many providers and then take this long, a year, 2 years, by the time they see someone like me.
Excellent. So I think if we distinguish, am I hearing correctly that you're saying there are patients that you see with major depressive disorder that fits diagnostic criteria, but the patients that you wrote the book for and that need your help more are the patients that their doctors aren't nailing down a specific diagnosis. So it's kind of like, I think you're depressed, take this medication.
Well, actually, it's both, because it doesn't take much to meet the criteria for major depressive disorder, single episode, mild. It really doesn't take that much. It's also sometimes used as a wastebasket diagnosis, so to speak, for a lot of things, from Lyme's disease to fibromyalgia, chronic pain, even substance use disorders. And I mean, technically, you're not really supposed to give a psychiatric diagnosis until a quote medical disorder is ruled out and a substance use disorder is ruled out. But honestly, people don't really take the time. Providers don't take the time or even have the time, honestly. If you think about it, an average session is 7 to 15 minutes to be able to really get that history and sort it all out. And in a first session, a lot of people aren't necessarily going to be forthcoming about the truth about what's going on in their life. And so it takes sometimes multiple questions and asking the questions in the right way to be able to glean that information.
Wow, powerful. Okay, thank you for the awesome answer. And you know, it's not like you scripted that; it's just that's truth. And so I want to dig into that a little bit. So it's important for the watchers, listeners, viewers to understand that it's not necessarily a bad doctor that they're seeing. It could be a doctor that loves them and wants to help them a lot, but that doctor is under certain shackles of the healthcare model that they're in. So like, hey doc, you have 7 minutes, figure out what's wrong with this patient. Well, that model doesn't work, and I think the US healthcare system is showing that. And so what happens is you get 7 minutes, you get a prescription, and you're on with your day. You left feeling not heard, and you may be taking a drug that is causing an iatrogenic issue because, you know, there was no data behind giving you the drug other than the symptoms you listed as the patient.
Right.
So, and that can make you tell me, but I would imagine, I can't prescribe, but I would imagine the prescribing doctor may feel like a vending machine more than a doctor at that point. And the importance then is, it's not necessarily the doctor's fault. It's more about the system that they're forced to practice under, and we need a paradigm shift that puts the patient first and the detective work necessary to determine what's wrong with that patient first, rather than pumping so many people through per day on 7-minute clips.
Right, right. So let's back it up a little bit, because I want to make sure that people understand that the current medical model is fantastic for acute care. If you're having a heart attack, if you're having a stroke, your asthma attack, anaphylactic reaction, you want to have someone determine immediately using a decision tree about what's going on very fast and implement treatment right away. And so that model really works very well for emergencies. It does not work well for chronic problems, because people come to a doctor or a nurse or, you know, chiropractor, and they're looking for answers, and it's not usually just one problem. It's usually a multitude of symptoms that are due to a multitude of problems. And you know those people when they're on more than 5 medications, you know, so you know right away, you know, or if they have multiple diagnoses, you know right away, okay, we have a person with chronic issues. And those symptoms are being expressed by something that's going on in their body that has something to do with their immune system not working appropriately. And, you know, you talked about paradigm shift. That's an acronym. SHIFT is an acronym that I actually use in my book to remember the 5 pillars basically that we look for. And that would be stress, hormones, including stress hormones, infections, foods, and toxins. And those are the major areas of drivers. But then it's looking at what we can remove in those areas that are causing inflammation, what we can replace and give to the body that's not allowing for the immune system and all the organs in the body to work efficiently, remove that inflammation. And you know, 80% of your microbiome, your gut bacteria, is your immune system. So we want to make sure your microbiome is working appropriately and efficiently. And then we want to repair the gut lining, which is where the immune system basically becomes more organized. It's all really in the gut, and that's where I usually start.
Okay. So forgive the question, but what drug does all that?
No, none. There's no drug that does that.
Okay, good. I knew that, but just in case. So then what does treatment look like? If I'm a patient with depression, or I've been told I have depression, and I've grown up that you get a pill for an ill, right? So the paradigm shift has to happen on a healthcare level, but oftentimes in the patient's mind as well. So what does the care look like for the patients you're seeing?
Right. Well, I mean, it really is a person that needs to look at it as serious work. It's very easy to pop a pill. And so, you know, unfortunately, when it comes to everyday problems, most people would prefer to take a pill for something instead of really doing the work. And so it is that group of people who are tired of the system, not getting answers from the system, are desperate and really not feeling well and feeling like they're getting worse and worse, that find a person like me to work with them. And it is changing your diet, taking a lot of foods that cause inflammation out of your diet, adding foods into your diet that are healing and giving the body the nutrients that it needs in order to heal. Changing your lifestyle in terms of if there's a lot of stress in your life, you want to look at where that is in your life and what changes you can make, because stress by itself alone, all by itself, can cause a great deal of inflammation in the body. So what did I say? Foods, infections, toxins, stress. So toxins we're surrounded by toxins. So again, looking at our toxic exposure acutely over the years, but also what's going on chronically, around you. What are you putting in your body, on your body? What are you breathing, that can be removed, because all those kinds of things can cause inflammation. And lastly, it's looking for chronic infections. And, and the only way to do that piece is really through doing some kind of testing in order to know exactly how to address it. But the rest, a lot of it can be done on your own, by really setting some goals about where you want to be in your life and what you want to see change, and then changing habits one by one,
Yes. And so do you have so I think probably most of the viewers know that, but the problem is doing that, right? So they all set New Year's resolutions, but we're at the end of February and they've probably fallen off. So have you set up a system or a structure or a plan where you could coach them, or they could work with you in some way to do what they know they need to do, but have some accountability?
Right. It's not just knowing what they need to do, but also in what order, and having accountability. So having a health coach or a coach, that's also a provider of these, because, sometimes people can be a coach and not really know the medical end of it. Right. Because, sometimes people could get in trouble if a coach doesn't know some danger areas, like, oh no, at this point you really need to see a doctor,
Right.
I saw a review by somebody who was depressed and suicidal and was seeing a health coach, and the health coach said, "You're going to be fine. Just take these vitamins." It's like, no, that person should have been sent to the emergency room. Right. So it is having all those skills to be able to sort those things out that I think are really helpful. And I think when people feel they're in the hands of someone who knows those kinds of things, it's not just being a doctor, but also being a nutritionist and also being a coach. So I did create an online health coaching group online health coaching program to assist those people in that group of people who are being told that they're depressed, but they don't really think that they're depressed, but they don't really know what is going on and just need some guidance about how to get from where they are in 12 weeks to feeling really good and having answers.
Excellent.
Solutions.
Excellent. So how do I as a reader sign up for that if I'm watching this and I'm interested? Where do I find that 12-week solution?
Well, you can go to my website. It's www.achinasteindo.com, ACHINASTEINDO, that's my degree, .com. And you can actually download, your readers can download my book for free awesome. From that website, and then can sign up for schedule a consultation call from the website as well, if they're interested in working with me.
Excellent. Well, that's wonderful, and I'm happy that you've not only put the book out there to reach more people, but then you've created a next step for people that have read the book and want to take action. And I think that's a big value add that's not part of every book that's out there. So we could go read a book on depression and addressing it naturally, but then you're stuck with, okay, now what do I do? So thank you for making yourself available to your readers, because as we've discussed, they're not going to get it typically in the conventional model.
No. Yeah, there aren't very many programs out there, and it is a Q&A. It's live Q&A. It's not just modules. It's also with me on a weekly basis.
Oh, that's awesome.
All online.
Awesome. I think I'm going to join it just so I can talk to you more. So as we wrap it up here, Doc, is there anything you want to say further to viewers, or any more information you want to share? Here's the open forum for you.
Yeah. So, I think what I find that when people finally see me is that they're really glad that they trusted their intuition to keep searching. And I think if you know in your heart of hearts that like this doesn't sound right to me, I think have the courage. I'm letting you know that go with that. Have the courage to keep searching,